Good afternoon, everyone. We still have quite a few people that are joining, so I'm actually going to give 1 to 2 minutes to get everyone else into the webinar, and then we will begin. Really, really happy to have you here with us. All right. Good afternoon, everyone. Thank you so much for taking the time to join us for the launch of our Lunch and Learn series for 2022. I am so excited for this conversation with Dr. Anu Partap, and I know that you'll be grateful that you took the time to attend. My name is Jessica Trudeau, and I am the Managing Director for TexProtects. If you are new to TexProtects, our vision is that children across the state of Texas can be protected from the trauma of child abuse and neglect, and that children and families have everything that they need in order to thrive. We are the only nonpartisan, policy-based nonprofit organization in the state that is dedicated exclusively to the prevention and intervention of child maltreatment. And so with that, a few housekeeping tips or reminders. You are automatically muted, so you shouldn't need to worry about that. We have a question and answer function, and I will try to monitor that throughout the entire call and address questions as they come up, but we will also have time at the end for any questions that may have arisen. Also, we have staff from our team that will be dropping resources into the chat link so that you can have them. Finally, we are recording this session, and so we will share this out with all registered participants after the event, and you are welcome to share with others. And so with that, I am going to introduce Dr. Anu Partap. We had such a lovely preparation call for this, and she and I have the same distaste for having others read enormous bios on our behalf. I joked with her that I usually just want people to say, this is Jess, and she's passionate about these issues. So I am going to respect that on her behalf, but I will tell you that she has been a pediatrician for 20 years. She is currently the medical director of health equity for Cook's Children's Healthcare System. And personally, and on behalf of our organization, we are so incredibly grateful that she serves on our board of directors. But with that, I am going to ask you, Anu, to share just a little bit more about yourself and really what draws you into this work.
Yeah, sure. Thanks, Jess. And really, thank you for asking me to do this, have this conversation with you. I'm looking at the participant list, and it's 150 people have logged on. So we're all having this conversation together. It just happens to be Jess and I that are on screen. And I really do hope y'all submit questions like Jess encouraged. You know, I've been drawn to this work since I guess I was 21, which has been 31 years now. And it started really because I listened to a survivor speak in college about her experience with what we called domestic violence back then. And I was so struck by the intensity of her experience, how it affected her now, how she'd come out of it, how she became this advocate for others. And I can say now that there were a lot of women that I admired who, in my community, my Indian community, were victims that I didn't realize were living that way. So it was just the first time I'd really heard someone openly talk about family violence. And the next day I went to clinic in med school and started asking my patients. And I couldn't believe how many patients that I had been taking care of at that point for only a year, but still, these were mostly women who had struggled with managing their diabetes, their high blood pressure, just different things that we were constantly trying to and failing, frankly, at helping them with. And I think that's when it started, this idea that, oh my gosh, there's so much more to what we're trying to do in medicine that we don't know about unless we ask. And that's really underpinning people's health and well being. When I chose pediatrics, it was this weird thing where I was still very focused on domestic violence, but now I realized this is probably our biggest opportunity to prevent child abuse. So I always said I'm not a child abuse advocate, child prevention advocate. I'm just worried about domestic violence. I didn't really understand at like that early stage that that's where this was headed. But ever since then, it's just been a career focused on what was first domestic violence and broader family violence, developing programs, integrating it into primary care. And this was even before the ACEs was a term. And once the ACEs study published, I think from then on, it just became such a core part of pediatrics. It was easy to find others who are passionate about the work. And it's just a great community to belong to and continue this work in.
Thank you so much. I love what you just said that we're going to talk about the research associated with adverse childhood experiences, in particular, the latest research, but it starts like behind every statistic is a human being.
Mm-hmm.
Behind every statistic is a story of someone that's been impacted. And, you know, looking at, we're now up to 161 participants. Statistically, there are many individuals on this call that have been impacted by family violence, myself included. And, you know, we do the work to make changes for the community. We also do the work for every single individual who has had the experience. And to prevent children from, you know, ever and families from ever having to experience abuse and neglect. So a significant portion, everyone on the call should have received our recent report on adverse childhood experiences. And, you know, there's significant evidence that indicates that there are increasing adverse childhood experiences and increasing trauma that children are facing, in part because of the pandemic, but also because of other situations that are occurring. What do you say to children or adults who have experienced ACEs?
Gosh, the very first thing I would say is like, you are an awesome person. You've got this. You are going to be fine because you're not in it alone. I
Mhm.
mean, the pandemic, and I'm a little bit more nervous today around talking about ACEs than I think I have been before because we're still in the pandemic a little bit, right? But for sure, we have all come out of various degrees of trauma, fear, uncertainty, upheaval, and we share now collectively what that feels like. And
Mhm.
I know we're all in different places on where we are today with it. I think when the pandemic first hit, there were people like me who, and many of us, I think, who were worried, right? Like we could look ahead and say, oh my gosh, many people are losing their positive coping strategies. People are losing their lifelines and connections because we had to shut down to make sure we survived the pandemic. And I think a lot of the increases in adversities or the ripples we're seeing from adversities are natural outcomes of going through something that was so unpredictably difficult and unpredictably long, right? Like we couldn't say this is going to end. When there's a tornado or a fire, like you know, like it's going to end, right? with this, it was like every time we thought it was over, it started up again. And so I think the fact that we have all made it is huge. I think we have all experienced different degrees of loss and grief. And those of us who have experienced the loss of loved ones, really, my heart is with you. And I think we all need to realize and remember that we have people who are really still grieving losses from COVID. We have children who have lost loved ones. We have families who lost income. And we've also had families who were just getting by with managing addictions, who were turning the corner with how safe they could live with their family. They were getting a grasp of their intimate partner relationships, and then it all flared again, right? And some of that has ended for families and some of it continues. I would just say that we all need to know what our strength is. We all have an inner strength that says you deserve to be safe, you deserve to be loved, and you're not alone. And then we also have to have inner strength to ask for help. And I think that last part is what I worry we will forget as things look more normal, right? Like we're expecting people to somehow move on. And I would just say that part of moving on is moving on well. And it means asking for help where you need it without shame, with dignity. And for those of us in the helping profession, we need to be ready to receive
Mhm.
people with dignity and grace and realize we're all in different places right now, like we were before the pandemic as well. So,
Thank you. Again, I loved our call before this where we were talking and you offered that you like to start everything really rooted and grounded in resilience. And it's easy for us to dive right into the research and right into the numbers and forget the implications for sharing that on what individuals who have experienced a high number of ACEs and have experienced trauma are, that there's always hope in what we can learn and come out of this. I also really appreciate that you just offered this encouragement around connection. I thought about Brene Brown saying we are hardwired for connection. And when we think about adverse childhood experiences, when we think about how children build resilience, one of the protective factors, according to the CDC, is to exist in close relationship, whether it be with a family member or be with a teacher or another community member. And so I'm so glad that you brought up those things. And I think if for anyone on the call today, we're going to talk a lot more about children and families and what they're experiencing in the community. But for anyone here today, if you needed to hear that, we hope that you remember to ensure that you have the support that you need. So going a little bit deeper into the research, there are really significant disparities when we look at certain communities and populations in the research. And we know this to be true for a number of reasons, including at the systems level. I was wondering if you could share your reflections on disparities that you encounter in your job focused on health equity, and some of the solutions that you lean into.
yeah, thanks for that question. Inequity is one of those things where once you see it, you can't stop seeing it. And it's really important when we talk about adversity that equity and inequities and disparities are sort of baked into that language. Because what's really happened is when we try to help families with the struggles that they share, they're seeking resources. We sort of think one size fits all, don't we? Like many times we think, well, here's this phone number and you can call and they're going to help you. And I think what we see is some families call and some don't. And I think when families don't call, our first reaction is, I wish they'd called. Why didn't they call? They're not making it a priority. And I think instead, what our work in equity for decades really has taught us is that people reach out when they feel they'll be received. And part of our challenge with equity in the space of adversity and trauma is all of us reflecting, have we designed, welcomed? Do we receive families so they feel that they are valued and going to be heard and going to be received um, for who they are, respected and valued for who they are, and not for who we think they should be and how they should be.
Mhm.
I think we're in this really strange time right now where we have spent decades and decades making sure equity is a priority. Uh-oh, there goes my camera. Um, and that is on my side, Jess, just so you know.
Okay. Okay.
So I'm going to say this one thought and I'm going to open up my other computer so we get the image back.
No problem.
Okay, I think that one thing with equity is we can always be thinking each day and each moment, am I doing anything that makes this person or family feel less than? Am I communicating that who they are, how they identify, how they celebrate themselves, has that been received and welcomed, or have I done something that has added to their stress, trauma, and separation from me? You use that word connection. And it's what am I doing to either grow that connection or what am I doing to separate that connection? And it's really one of two. We do one of those two things every time we engage with someone who comes to us for help.
Mhm.
Um, so I'm going to try this. I haven't done this before.
You
To
are
switch
fine. This
computers in the middle of technology at its best, right?
this is 2022.
Yeah, let's
We
see
have
what
all
happened.
learned how to offer grace and compassion around technological issues. I had some this morning, so no problem at all. I'll highlight a couple of things that really stood out to me in what you shared. Well, you opened with, this idea of, the single variable that's going to make a difference. Some say like the silver bullet, and I've worked in child abuse prevention and intervention for quite some time. So actually the majority of my career, and have often heard that, like, what is the one thing that will help children and families? And the truth is there are too many to list. And so we have to simultaneously work in all of these areas to ensure that children and families have what they need. And then the other I wrote is a about really seeking to understand from a parent's point of view, or from the family's point of view, how best to serve them. And I'm really encouraged by so much of an emphasis on racial equity, and so much of an emphasis on how to ensure that we are serving families and meeting them where they are. But I appreciate all of those points that you brought to the surface. um, so, you started, it was perfect segue to my next question, and you started to lean into some of this, but, in your particular, care for children and families, and then with what you see at Cooks, where do you see the most significant gaps to be between what families are truly needing, and what we are equipped to offer, either as individual practitioners or as a community as a whole?
Yeah, and I think probably I'll end up answering this question looking back over a lifetime across different systems, and it certainly extends here in Tarrant County and at Cook. And so Cook Children's is like many other large systems. We'll have over 1 million patient encounters annually.
Mhm.
And when families come here, we also know for every family we meet, there's a bunch that are either not going to ask for help or will come for one reason, and there's three other things we probably needed to be aware of, right? And so, one of the things that we really know we need families to be able to do is catch our attention for what is really their biggest concern with their children, and to trust that what they say will be received and heard and respected. I think when families don't believe that to be the case, it's easy to hide what's really happening. And then they leave, maybe not with exactly the right support for themselves or for their child. And then what happens, right? We see you back again and things are a little bit worse. Or we see you back much later and things are even a lot worse. And so these opportunities for early intervention slip by us, and they slip by all of us. I can say that as a pediatrician and as someone who's watched programs come and go. For every family we serve, we have to give them the space and the time to share what's happening. One of the things that I think people have done, and I would say this is a gap rather than opportunities, I think people are excited about seeing the ACEs questionnaire as a screening tool. And I get it. I get how exciting that can feel to hand someone a questionnaire and they mark off their ACEs, and now you have a handle, or their child's experience with ACEs already. And what the caution I would say about that is a few things. One is, when we want families to share the adversity first, we expect them to have to share something really personal, scary, and uncertain to receive support or help. And I would say right now, after a pandemic, when the default we've all experienced some form of upheaval, trauma, or uncertainty, let's just make sure everyone knows where to receive support and services. You shouldn't need to disclose or share or trust what you're going to tell somebody. And I, as a provider, if I were still seeing patients, no one should have to tell me what's happening for them to receive services that aren't even in my own clinic, right? And so I think that's one gap. We just need to make sure everyone knows about certain services and supports, whether they've chosen to share what's happening or not. I would say the other opportunity we have is, if you're using the ACEs questionnaire or something similar as your primary pathway for knowing who to worry about and who not to, that tool was not intended that way. I think it's one thing to use that questionnaire at home with yourself or your family, or maybe at a population level where you want to know, like, what is the predominant concern that my families live with. At an individual level, and I'll give this as an example, the tricky part about an ACEs score is that it's a score of 1 for divorce, and it's also a score of 1 for sexual abuse. And we know at an individual level and through research that those are not the same trauma. But on paper, you would sort of look at that and say, oh, it's an ACEs of 1. And so I think the other sort of gap and opportunity is being really thoughtful around how we provide support and services information. And then secondly, how are we engaging and receiving that information for the purposes of early intervention and treatment? And really making sure we're doing justice to what adversity teaches us about the impact on families and individuals.
Thank you.
Sorry, that was really long. I just got going there and I couldn't stop.
No, it was wonderful. And, I think it's the difference between screening, which it is important. It is incredibly important to screen families for family violence. It's the difference between screening and creating a safe space where families and individuals can open up. And so I want to ask now a follow-up question. As you recommend not using the ACEs, and I agree, that's a research tool and was designed for a different capacity. How do you, because we all interact with children and families, every one of us, we have 171 people on the call. And so some of us are home visitors or administrators of programs. Some of us are medical professionals. How do you personally build out that sort of safe container? Or have you in the past with families in order to encourage them to open up and share about what their critical needs are?
Yeah, it's a great question. This is where I wish we were all together, right? It'd be so fun to hear what other people say. I think what's worked for myself and others I work with is, number one is safety. So if you see something concerning, you see a child with an injury, a mark, they're really underweight, they're not receiving medical care that is life-saving or essential for function. we have to report that. And I think when we make those reports to CPS, we make them out of love and compassion for that family unit. It is so that something worse doesn't happen. This child can immediately receive intervention and life-saving interventions as well, and that the family can receive the support they need to love and raise that child the way that they meant to raise them. So safety first. And I think one of the pitfalls of adversity work can be that in our efforts sometimes to support and give space, we can sometimes forget that safety is first, and we have to remember safety first. So you triage for safety first. The second is, I think, when you meet that parent and you're like, yeah, they're struggling. They don't know they're struggling, right? They either maybe they're depressed, maybe they're detached, um, maybe they reference or allude to something that's happening with their spouse, partner, co-parent, grandma, whoever they're living with, and we let it slip by, right? I think we all have this opportunity to say, I noticed what you said. Do you want to talk about that some more? And it does a couple things, I think. One is when people mention something, they're almost hoping you'll hear it, right? Otherwise, they're not going to say it at all. Or last time I saw you, you looked a little bit different than you do today. Are you okay? And those openings, I've received those openings myself from family and professionals. Oh my gosh, right, you're waiting for that sometimes or don't know you're waiting for it. And we all of you do that even way better than I probably ever have. That is a very meaningful, small, intense connection that you're making with that family, and keep doing that. I think that the third sort of touches on screening, right? Whereas you're not noticing anything, they haven't said anything. We know the pandemic has been this unfortunate great equalizer of difficult times. Housing, food, employment, early child care access, um, just having enough week to week, as well as just having connection or grief and loss. You may not be able to ask all of those individually, but if you have some kind of guided, either memorized list, right? Or if you're more comfortable, some people like sharing on paper. If you want to give a tool to someone, I think the way it's given makes a big difference to normalize it, right? We know that things have been tough for families. We want to give you a chance to share anything that you'd like support and services for, or that I personally can help you with. Here's a list of things that we know families commonly struggle with, right? It's very normalizing. And oftentimes, you've probably had this happen, Jess, where someone will share a story, right? They'll talk about their sister, their cousin, themselves, and it just makes it so conversational, and you're creating that connection again, which is a lifeline for the children that you're there to serve. But that lifeline is created through the caregivers in that child's life. So,
Yeah.
so those are.
I have such a core belief that as individuals, whether adult or children, we have this really core need to feel seen and understood. And so I really appreciate that about what you just offered. Again, I'm going to add on a question of, I know personally for myself, there have been times where when I was working directly with families that it can be really tough at the end of the day. You know, we show up in a manner that creates this sort of safe vessel and space where families can share their stories, and some of the stories are are really tough to hear. And so I guess my next question for you would be, no matter what type of practitioner people are, what do you recommend in terms of self-care to be able to continue to do the work of creating that safe vessel?
That is such a great question. I think I'm probably still a work in progress on that. So I'll tell you what I've not done well and what I think has worked and what others have advised. So I think I will say, so I spent probably 20 years working with families who were more likely to have had family violence than not, or have faced some kind of extreme hardship. Nothing was intense as the 8 years I spent as a foster care pediatrician. To hear and learn what children in Texas have gone through, both prior to entering foster care and then while they were in foster care. A lot of beauty, a lot of strength. So, one thing I would say is, in the midst of reading or hearing the stories of suffering and struggle, is taking a step back and saying, "Oh my gosh, and you're doing this beautifully." To recognize the compassion and love that that child still has for their family and for, in that case, their foster family, to have the will to go to school and set goals for the future, to say like, I'm going to make it through this because I am who I am. And that is very like recharging, right? It's energizing because you're seeing the whole point of adversity work, which is, in spite of all these things happening to me, through love, connection, and treatment, I'm going to make it. And you can really lean into that to make it through the day, the week, the month. The things that I didn't do so well, I will say, is it's sometimes hard to separate out what you're trying to change at a system level and keep it out of the moments with a family. So those moments with family are predominantly beautiful and amazing. Trying to improve the system is where we can start to feel kind of drained, right? Things take longer than we want. It's so obvious to us what should be fixed and it's not. There's competing priorities. And I think separating those is something that I'm still a work in progress on, I'll say. But I think that it really helps our families to not bring that baggage in to the room and to not bring that baggage into the relationship. I will say, one thing that I found myself doing is when I would read to my children at night, right? I'd go home from clinic and I would be reading to my kiddos, my own kiddos, and I could picture all my patients from the day in that same bed, like I was reading to all of them. And I don't know if that's healthy or not, Jess. I can't say, but I can say that it really helped me feel like I was connecting in a way that was both as a pediatrician, as someone who just saw them as a human being who just wanted connection, love, and support. And it helped me sort of feel that um, more holistic presence with my families, I think. And I think the last thing I would just say is one thing that professionals have really advocated for, and I've tried to for different teams I've worked with, is we've got to be able to lean on each other confidentially, uh, vent when you need to, get it out of your system, don't take it home. And when we do need that extra help, because it's getting to be too much, there is professional help for professionals. And people who do that are really, really good at meeting us where we are.
Thank you so much. I think that reflective supervision and reflective support for professionals that you mentioned is so important. I know for me, some of the ways that, and I'm on my own journey, aren't we all? But some of the things that I've learned is that I have an opportunity to give myself self-compassion in the same way that I more easily offer compassion to others. That children in front of me want to hear you are whole and worthy and complete just as you are, but yet I need to hear that as well. And then I love what you talked about, the basis and the foundation of adversity work. I had the great privilege of working at Momentous Institute before I joined TexProtects. And the therapist would often say that the children in front of them or the families in front of them, they already had everything to heal already within them. But it wasn't the therapist providing them with the toolkit on how to heal. It's just being there to walk alongside on their journey. And that has really stuck with me, that, if we can all remember, whether as professionals or practitioners or for the families that we support, that it's already there. It's so encouraging. And so we've already started to talk about what brings you hope and how you participate in being a vessel for hope in this world. I'm wondering, what are the things when you think at a community level or a population level, what are some of the things that you feel encouraged about in terms of how we are all collectively coming together to meet the needs of children and families and to raise up families to prevent them from ever experiencing abuse?
I think the stigma around family violence, adversity, tough times has really gone down, hasn't it? I mean, there's no way we could openly talk about mental health. There's been a mental health emergency declared for our children. And part of that is because so many families are taking the brave step to seek help. Um, and and 15 years ago, we were just begging for people to even answer questions about it. So that gives me great hope that there's an expectation for well-being and expectation that mental health matters. I think all the advocates who've been at it for decades, kudos to all of them and their ongoing advocacy. I think that, am I sad that it took 2020 for equity to be a household word? Yes. But am I grateful it's happening now? Yes. And I think uh, let's make sure it's not a fashion or a fad, right? That we're talking about equity and inequities and disparities. But it gives me great hope that we're even talking about measuring things differently based on people's attributes and identities. And that we're talking about different ways people experience things, not to blame them, right? Because I think what used to happen 20 years ago was we would measure a population, say, see, like, look how they are. And now we're saying, see, we're not serving people the way they've asked for help. And I think that's a really important and exciting shift that we're making.
Mm-hmm.
I think the other thing that gives me hope is that we are coming through this portion of the pandemic showing what we're made of, right? I see a lot of people wanting to connect. I see a lot of compassion. I see a lot of love happening as people are taking their masks off and going out again, and it reminds us of the strength that we have.
Mm-hmm.
And I, the beauty of that is it reminds us what we're made of and that we are wired for connection and we're also wired for survival.
Mm-hmm.
And let's make sure we do that as a community and not as individuals, right? That we're all, as well as our children are doing, and all children, not some, but as well as all of our children are doing. And that dialogue that TexProtects and other agencies have been keeping at the forefront is going to keep us all honest. And so that gives me a lot of hope as well. Because the medical profession, we cannot do this alone.
Yeah.
I don't think any profession can do it alone, but certainly with all the advocacy that you all provide and everyone provides, we can get there for sure. So.
Mm-hmm. I so agree. I've said for a very long time that if we want to heal our world, if we want to heal our community, our state, we need everybody at the table. There is no one organization or one sector that can do it. So TexProtects cannot do it alone. The nonprofit sector cannot do it alone. We need corporations, we need the faith community, we need state government, et cetera, to come together and work towards having a state where children can thrive and families have everything that they need. You've started to answer this, and we have about 5 minutes. I have several more questions, but we have about 5 minutes, and then we'll open it up for our Q&A session. You've started to answer this, and I'm going to provide information to all of our participants on how to support the work of TexProtects, in particular our policy efforts. But, for the individuals that are on this call today and thinking either personally or professionally, what can I do? Like, I'm so bought in. I believe what Jess and Anu are saying, and, I see the opportunities. What can I do? What are the things that come to your mind?
I think the very first thing we can all continue to do is make sure that every child feels loved. I mean, love is the simplest word for what we need children to feel to be able to make it through whatever tough times are happening today or whatever lies ahead for them. That word resilience that we use, it's really, resilience is founded and grounded in love. And that's the first. I think the second would be, let's not create adversity where there isn't any. We're at this very interesting time where we want to prevent adversity and trauma. And part of that means not giving families a reason to feel less than, feel less valued. Let's make sure that we do everything we can and not add kindling to a fire, but at least make sure people feel embraced and valued. I think the third would be, when families are struggling, if myself is struggling, a parent is struggling, or a child is struggling, we need to help them find help. Ask for help, connect families with support and services. And that doesn't mean a referral. It means sometimes making sure they don't feel like they're alone, that there are people who care about them, and that there is help available for as soon as they are ready. And safety first is part of that, seeking help and support. And I think those would be the three things. Yeah.
Also important. I will add to yours if that's okay. Something that's become so important for me as my career has evolved, and that's in particular for leaders on the phone, that for us to remember that our employees are humans first too. And so going back to that reflective support, I knew that we were talking about earlier, I say oftentimes our employees are human. And so we have to, or have this really beautiful opportunity to lean into, they have also had their own experience of trauma in their lifetime. And so in addition to supporting the children and families and creating that safe vessel for them, there is a re-experiencing oftentimes of their own trauma. And I think for me, I've been, gifted to have so many mentors in my life that have helped me learn how to navigate that balance of, yes, there's so much work to be done. And the work is so critical, but we have to take care of our people.
Absolutely. I'm glad you called that out, because I think especially, it's always been true, Jess. I think that's always been true. But I will say that during the pandemic, the lines have become blurred, right?
Yeah.
Between who is helping and who needs help.
Yeah.
And none of us can serve the families who walk through our doors if we haven't helped each other or ourselves first. I'm so glad that you said that.
Thank you. So we now have, and this is perfect timing, it's 12:43. So we have one question that's come in. I want to encourage everyone to please send in your questions. If you don't have questions, I have plenty more for Dr. Partap. But the question that's come in is, why are the ACEs scores not different for intensity of trauma, diverse versus sexual abuse? And so, Dr. Partap, if you want to talk about the origins, the initial research that was conducted in 1995 and 97 and how the survey was established, and maybe also how we can pull up from that initial establishment to address these more therapeutically.
Sure. Sorry, my phone never rings, and of course, between the video camera and on my phone. The ACEs questionnaire is a really good research tool meant to correlate what experiences happened in childhood and how was that associated with adult conditions, whether it's behaviors that we struggle with, lifestyles like with employment or education, or with chronic conditions that really do affect our functioning and our morbidity and our mortality. And so it looked at, the more adversities you had, the more likely you were to have certain chronic conditions.
And at a population level, right? It was never meant to be a diagnosis.
Right. And it has been repeated internationally. So what it allowed us to do is say, globally, when bad things happen in childhood, it matters to your lifespan. It matters to your life course at a population level. It doesn't mean it's a blueprint, though, right? So where it breaks down is at an individual level. And the reason is when they look at the different adversities that are only in the ACEs questionnaire, those are just like 10, right? Now, there's not hundreds of adversities, but there's at least 5 or 10 more that are evidence-based. But we know internationally and in the US that sexual abuse, out of all the adversities listed, sexual abuse is the most highly correlated with difficulties later in life, whether it's physical health, emotional health, different coping strategies that become unhealthy for us. That sexual abuse is the most, if you want to use the word toxic, of the childhood experiences. And the ACEs questionnaire was never meant to weight any one of those against another. I think the other thing to keep in mind is that the ACEs questionnaire is completed by adults. So if something happened to them really early in life and no one ever told them, it's not going to be on the questionnaire. These are things that people recall happening sometime in the first 18 years. We also know now that prenatal and the first early years are the most vulnerable for different biological pathways that are associated with lifelong struggles or even pediatric struggles, right? And the ACEs questionnaire will miss that. The third limitation I would say about the ACEs questionnaire is that there is fatal child abuse. There's fatal child neglect. Those are not going to be reflected in questionnaires. And so I think, now I will say, I had my children take the ACEs questionnaire as a way for them to reflect on what their life experience has been so they could use it as a tool of strength at home to say, I have had some difficult things happen and I can be strong and figure out how that affects me now and what I can do.
Mhm.
So we have to be very cautious how we use it, and that it's really used in a way that's not to create treatment plans, service plans, or to triage which patients need more support and which ones don't.
Thank you so much. I that really resonates with me. And I also think about, this is not a lunch and learn on the impact of toxic stress and trauma, but that the other thing when taking a tool like this and adopting it towards developing an individualized treatment plan is that everyone experiences adversity differently.
Mhm.
So children and adults will experience the same ACE, but respond very differently. And for some, it will lead to trauma and toxic stress. And for others, they will have a different response. And so that's also important. We have another question that's come in, and it's, is there a bigger correlation between certain of the 10 and adverse outcomes? So I think, chronic and longitudinal outcomes other than sex abuse.
I think when I read the literature myself, here is what always kind of is swirling in my head is that the mitigators or the things that temper a child's reaction to adversity, and Jess, you just alluded to this, is, there's biology, there's genetics, there's who loved and supported you through this difficulty, who did you feel had your back during it, what is your temperament, how old were you when it happened, how often did it happen, and all 10 of those have different answers to those, right? Like divorce or separation could be once or 10, but why did the separation happen?
Right.
Incarceration can be one person who loved you and they were incarcerated, and everyone around your family support you through through someone being incarcerated, and it was okay. But if you were physically and emotionally neglected for the first 5 years of your life and you didn't think anyone had your back, that's a very different experience from the 2-year-old who enters foster care and is surrounded by love and support while their family receives help.
Mhm.
And so all these different factors are hard to measure in any research, right? Because it's recall, There's some prospective studies being done where you're following people in real time for years and years, and we'll see what that looks like. I will tell you anecdotally, I can't tell you from research, but the children who I've cared for who lived in homes with intimate partner abuse, where it was frequent and over a period of time, I will tell you they seem to suffer and struggle a lot more than my other patients. There was something really different about their recovery timelines and the amount of treatment that they needed, and they can do well, but I would just caution all of us that when the adults caring for you are also scary and frightening, and you don't have anyone left who's kind of watching out for you, that seems to be a really intense experience for children. And so I just want to call that out, especially now where we're seeing a rise in that particular adversity.
Yeah. It's so important to remember. And I think I'm a parent, and that's my number one job before, managing director at TexProtects, and remembering that in our eyes, they need to know that they're safe. And that for children, but whether children have experienced, some of the adversities that we're talking about today or otherwise, that, they really have two options for processing. And one is I've caused it, and the other is I can control it. And so if I've caused it, then that says bad things about me as a child. And, that sense of identity starts to form. And if I can control it, it's if I act a certain way, and if I have either perfect behavior or I engage in really rebellious behavior so that I can draw out and get the negative experience over. It's just remembering how much of a weight that puts on children.
Yeah, and when children can hear that the adversities in their life were not their fault, and that the ripple that it has on their life, like their grades, their weight, their anxiety, their depression, when you can connect the dots between, well, you had these life struggles and this is why, it gives them a sense of control that's healthy. Right? Like, oh, it's not my fault. And you can see so much recovery start to happen. And we haven't talked about trauma-informed care, but part of being a good steward of trauma-informed care is allowing the child or parent to define the trauma, right? So we don't get to decide, well, that was traumatic, that wasn't, you look like you were traumatized, you look like you weren't. It's that if the definition is, right, that if the person experiences something that they felt frightened or alone by that has now affected them in some way, that's the definition of trauma. And that's where healing and connection can begin from, when you express value for that experience they had and value for where they can go from here. So it's a cool time right now, I think.
Yeah. I'm going to take a moment. I'm going to ask if anyone else has questions, but I am going to take a moment to talk a little bit about TexProtects and how we would like to partner with every person in your organization if you're representing an organization on the call. So our work is centered around education, research, and advocacy. And we have a variety of ways that you can connect with us. We are now in interim session when we think about our policy work, building out our legislative agenda for the 88th session. But really, when it comes down to advancing that legislative agenda and even crafting it, we've done a tour across the whole state to gather information and to engage in feedback loops with communities. But in order to advance legislation that will either support funding of prevention programs and services to support families, or systems modifications to ensure that children can be protected at every level, we really need the support of all of you. And so we will send out a follow-up email with ways that you can connect with our organization and take 2 minutes out of your day when you see alerts from us to be able to contact your legislator and be able to say, this is important. This is, as a constituent, this is important for me. This is important for my family. This is important for my community. And let me just say, at the end of session, when there are bills that are passed and budget riders that make their way into final budget, that is because of all of us. That is because of our collective effort. So we want to say, thank you so deeply for taking the time today, but we don't want this to be a one-time experience with you. We want to make sure that you connect with TexProtects, and someone else just offered. Of course, TexProtects works with an array of providers across the state. As I said, we cannot do it alone. Even the nonprofit sector cannot do it alone. And so we also encourage you to connect with partners, our CASAs and children's advocacy centers across the state that are providing the critical services on a daily basis. Dr. Partap, first of all, this has just been such a pleasure. This just being able to prepare for this and then have this time with you has been a personal gift of mine. I will say that I really am a person that tries to stay grounded and rooted in gratitude and hope, even though it's hard sometimes. I want to say that you bring me hope.
Likewise.
I
Yes.
feel blessed that we're on this journey together, but we've talked about a lot. Is there anything that you haven't shared or that, in hindsight, you would like to offer to our participants before we end our call?
Yeah, there's some great conversation happening in the chat I know we didn't get to. So I just want to say that I truly believe that parents want what's best for their children at all times. And when that's not happening, they're either distracted or scared by something else. And the more we can reassure families that we are going to support them in ways that keep their children in their homes with them, healthy and loved, I hope the more likely they are to trust us and reach out for help honestly and openly. And then we all just need to be able to look at our systems of care and make any adjustments we need to create that space for families equitably and honestly. And I know we can be a great state if we do that together.
Thank you. To all of the comments in the chat that we weren't able to get to, we will review those. And when we're sending out, the recording from today, as well as all of the different ways that you can connect with us, we will include resources that are specific to either the issues that were brought up or questions that we were asked that we could not get to. And so we are approaching 1 o'clock. I wanted to make sure that everyone was able to jump off and go on to your next meeting. What I will say now, just personally, is for all of you, we're talking about ACEs, and Dr. Partap and I talked about this, but personally myself, I have a high ACEs score. And I just want to underscore the hope and the resilience that Dr. Partap offered at the beginning of the meeting. The encouragement to be in connection and live in connection with others. And that reminder that each of us has within us everything we need to heal, but to get the support that you need. And so thank you so much for joining us today. And we hope to see you during the next Lunch and Learn series. Thank you.